Hi, my name is Christina McGassey, and this is my video on tracheostomy care. First thing I would do is close the door for patient privacy. I would then introduce myself to the patient and perform hand hygiene. Hi, Mrs. Smith. My name is Christina. I'll be your nurse today. Can you please verify your name and date of birth? Make sure I have 2 patient verifications. All right, and well, Mrs. Smith, today I am here to perform tracheostomy care on you. Is that okay? All right, perfect. And then I would go ahead and raise the bed up to a good working height. I would place the patient in semi-Fowler or high Fowler's position. I would then make sure to hyperoxygenate and suction the patient if need be. So we would do that. And then I would go ahead and get our kit out. Our tracheostomy kit is a sterile kit. So once we open that, we want to make sure we maintain that sterility. So first thing we would do is go ahead and open our kit. We would go ahead and remove our sterile gloves. Next thing we would do is go ahead and grab our sterile drape. And with the drape, we want to make sure we're only touching the shiny part because that is the part that's going to be down. And then when we open it, we want to make sure that we're only touching the 1-inch border on the outside of the drape. Okay, now that we have that open, we want to go ahead and remove our supplies. And go ahead and put the supplies onto our sterile drape. Okay, and then we want to make sure our tray is next to our patient because we will be using the tray to clean our inner cannula. So once we have that done, we would go ahead and put on our gloves. Okay, we would then fill these 3 trays that we have with a normal sterile saline and then also the soaking solution, which is just the cleaning solution. So once we do that, we want to go ahead and remove the inner cannula of our patient. So we're going to go ahead and do that. We would want to have somebody helping us, an assistant, to make sure that the trach doesn't get knocked or dislodged. So we're going to go ahead and do that now. I want to unlock it and pull the inner cannula out. And then we want to make sure we put it in the cleaning solution. So once we do that, we are going to make sure our patient's okay. And then we would remove the old dressing while we're at it, stabilizing that trach again. And then once we have that, we would go ahead and remove our gloves with our soiled dressing in our gloves and toss those. Okay, next thing we would do is we're gonna go ahead and get going on our sterile process. So I'm gonna move that. Still in the frame. Okay. Okay, so now we're going to go ahead and put on our sterile gloves. Actually, before I put on my sterile gloves, I would perform hand hygiene. Now I will go ahead and open up our sterile gloves. Making sure we maintain sterility. We want to just touch that 1-inch border again. Okay, and with our non-dominant hand, we are going to scoop under that cuff and put on our first glove. Okay, we're going to go ahead and grab the other one with just 2 fingers cuffing it. Okay, we have our sterile gloves on. Now we're gonna go ahead and grab our swabs and put those in the cleaning solution so they can soak. Okay, now we are going to clean the inner cannula by grabbing our brush, our cleaning brush, and we are going to clean the inside and the outside of the tube until our secretions are gone or it's clean. So now my left hand is going to be my dirty hand. So we're going to go ahead and clean inside, get all the secretions out. Perfect. Okay. And then once we were finished with the brush, we want to discard the brush. Okay. We would rinse the cannula, and then we want to replace that and lock it back into our lodge. Okay, make sure it's locked. Perfect. Okay, next we will clean the skin and the flange surrounding the trach. Okay. Clean, 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 toss. Clean, clean, clean. And then when we're cleaning, we want to take our swabs and we want to clean approximately 5 to 10 centimeters around the stoma as well as around the flange. Okay, and one more. This is also a good time to inspect the stoma and ensure there's no signs of breakdown or skin infection or anything like that as well. Okay, now that we have cleaned our patient and our stoma, everything looks great. We will want to take the sterile gauze and pat it dry to ensure that the skin is dry and the flange. Okay, once we're done drying that, we want to go ahead and toss our gauze. Okay, we will now replace the dressing on our patient. So we're going to go ahead and grab that gauze. And we're going to go ahead and put that on our patient. Okay, perfect. Now we're going to replace our tie. So we want to keep the trach stabilized when we do this tie. We want to make sure we're just careful not to hit it and make sure it doesn't fall off. So we'll go ahead and remove that tie right now. Okay, and then we're going to discard that. Okay, grab our new tie. And we're going to be using the one-tie method. And then when we do this, when we come back around the neck, we want to make sure there's no twists or anything that can cause skin irritation or skin breakdown. Okay. Okay, then we're going to go ahead and knot it. And if we need to use tape, we need to make sure that there's no tape touching the patient's skin once we knot it. Okay. And we're going to go ahead and we would want to take gauze and we'd want to make sure that the gauze is patting the knot so it doesn't cause any skin damage on the patient. So we're going to go ahead and do that. And then we want to make sure we check the tightness of the tie with 2 fingers just to make sure it's snug, but it's not too tight. So we're gonna go ahead and do that. Okay, perfect. Everything looks good. All right, how you doing, Mrs. Smith? Okay, perfect. We would then go ahead and replace the patient's oxygen, place them in a position of comfort, ensure the bed is low and locked, and the patient's call light is within reach. We'd go ahead and remove our gloves. We would clean up our supplies and make sure we didn't leave any trash. Okay, perform our hand hygiene, and then we would go ahead and document our procedure.